Hi, everyone. I'm Desiree Behringer Carton with Your American Cancer Society. Bienvenidos. It is my pleasure and honor to welcome you to our show today. We are so excited to be here to celebrate March, National Colorectal Cancer Awareness Month, and to recognize all the fantastic work that's being done with the 80% Every Community campaign, which aims to reach and exceed colorectal cancer screening rates of 80% in communities across the nation. We have a really special program lined up for you today with some exciting guests joining us. So before we get started, we are recording today's webcast, and the replay will be posted to the NCCRT website within a few days. We'll also have time for questions, so please submit your questions through the Q&A box throughout the program. And be sure to engage with us on social media. Use the hashtag 80 in every community to share about the exciting work you're doing this March and throughout the year. We want to hear from you. So to kick us off, it is my pleasure to welcome Dr. Steven Itzkowitz, a GI leader at Mount Sinai and chair of the National Colorectal Cancer Roundtable, Dr. Robert Smith, Senior Vice President of Cancer Screening with the American Cancer Society and co-chair of the NCCRT, and Dr. Lisa Richardson, Director of the CDC's Division of Cancer Prevention and Control. Hi there, everyone. We're so happy you're here.
Hi, thanks for having us.
Oh, we're so glad you're here. Thanks to each of you for being here. And I can't believe this is our 7th year of our broadcast, and for your continued efforts in championing this inspiring campaign. So Steve, we're gonna first off start with you. Congratulations on your new role as NCCRT chair. We're really happy for you to join us for your first March webcast. I hope you're doing well. So talk to us about the landscape for colorectal cancer screening. What does it look like this March in 2022? And how have really things changed over the past year?
Thanks so much, Desiree. While we continue to see so much energy, around 80% in every community, we're still feeling the impact of the COVID pandemic, which is now in its 2nd year, unfortunately. Early on, we definitely saw a precipitous drop in screening, but rates have actually largely rebounded. In fact, there's data from Epic EHR that shows that as of October 2021, we were only about 3.4% below historical baselines. However, we don't want to lose sight of the fact that we missed a lot of screenings in 2020 and 2021. It's that same report estimates that we missed about 27,000 missed colon cancer screenings between just January and October of 2021. We're also impacted by the fact that many healthcare staff have resigned or there's burnout. So those are issues. But at the same time, I'm confident that we're in a much different place than we were even a year ago. There's so much engagement around screening efforts. Healthcare systems are doing tremendous work to adapt and innovate to reach patients for screening. And some of the adaptations to COVID, for example, telehealth, increased screening at home, non-invasive stool-based testing, could be very long-lasting. So we're concerned that recovery is not happening in all communities necessarily evenly. And we're still concerned that the most vulnerable still face screening barriers that are not likely to recover as quickly. We're seeing even greater disparities in the social determinants of health that we know have an impact on a person's likelihood to get screened and screened on time. But this is why our focus on 80% in every community is now more important than ever.
Yeah, so true. We have to make sure that people get screened. Thank you, Steve. Lisa, so where do we stand with CDC's work around colorectal cancer prevention and early detection?
Well, thanks, Desiree, and thanks everybody for coming today. Well, CDC, we've made a lot of progress, as Steve said, with working with partners like the National Colorectal Cancer Roundtable, but we have been impacted by the pandemic. So the data that we have that's most, most fine is our breast and cervical program, where the numbers dropped precipitously like everyone else, but did come back up near the end of 2020, similar to what Steve said about colorectal cancer. And we also noticed the same thing in our colorectal cancer control program. Over the first 4 years, screening increased in each clinic by 13%. And in the 4th year, it dropped by 3%. So still an overall improvement, but we can tell that there has been an impact. You know, many of our grantees continue to reach out to people, use telehealth and different methods. And I'll talk a little bit about that next, but focusing on fit testing and making sure that people get followed up. And finally, you know, for us in the federal government and everyone else, advocates like NCCRT and ACS the president announced the Moonshot 2.0 in February, we're looking at a renewed commitment to ending cancer as we know it. And CDC continues to put into practice things that we know that work. And we look forward to continuing that work with all of our partners.
Absolutely. We're all re-energized by the cancer moonshot. And I understand the CDC works with healthcare organizations to use strategies to increase colorectal cancer screening. So how's that work going?
So the work, believe it or not, the work is still going well. Our clinics, like I said, noticed a drop in screening because of all of the reasons that we all know, as well as people losing their jobs during the pandemic or not going back to work for whatever reason, after having COVID. But I'm going to tell you a couple examples. One of our recipients in Wichita Falls, Texas, created a voucher program in their local health system. And the voucher program included a FIT test, as well as covering the abnormal follow-up with the colonoscopy. And they partnered with pharmacies, and they also ended up mailing out vouchers to people as well. So they reached about 500 people with FIT kits, 40% return the kits, which is a really good return rate. And 20 people with abnormal results received follow-up care when they needed it and are doing well. And another one of our recipients in Eastern Iowa gave people gas cards to get to their colonoscopy or their other appointments. And in the year with these changes using telehealth, navigation, and other processes, working in the health system, they were able to change the up-to-date screening in their clinic to 57% of people being up to date. So the work continues. People are dedicated to keeping the improvements going, and we look forward to working with everyone, as I said earlier, to continue that progress.
Oh, thank you, Lisa. And like you said, the dedication, such dedication to the cause, and we're all committed to making sure people get screened, and hearing those numbers are encouraging. So thank you. I know you're sticking around for questions later. So thank you, Lisa. Bob, we want to bring you in at the same time that we're continuing to adapt with COVID. We're also adapting now to near unanimous consensus around screening at age 45, which is exciting. So where do we stand with health plans and health systems making the change to offer colorectal cancer screening at age 45?
Yeah, so we actually began to turn that corner when the ACS modified its guidelines in 2018. But most plans are going to look to the task force because it links their plans to the Affordable Care Act. So we have, when the task force updated their guidelines and dropped the age to begin screening to 45 in May of 2021, under the Affordable Care Act, they would have to begin covering colorectal cancer screening beginning at age 45 for plan years that began a year after that. Most plan years are not going to begin until 2023. But the remarkable thing is so many of the big plans have already begun covering colorectal cancer screening at age 45. Aetna, Anthem Blue Cross, Blue Shield, Kaiser, TRICARE, United are some of the ones that have already modified their plans. Mercer, who is the world's leading human resources consultant, estimated that covering colorectal cancer screening beginning at age 45 would add about 20 to 30 cents per $100 of paid claims. So it's a very, very small amount. And this is something that we really do like to see, that, when you have a new guideline, when we've determined that we actually can save more lives, avert more premature deaths, we don't like to wait a year or two to get started on that. So it's been very encouraging how many have gone ahead and started that. Plus, some states were already covered, basically required coverage according to ACS guidelines. Those states implemented the changes earlier. And we're excited to see these changes. This is roughly 20 million Americans fall into this category. And as incidence rates continue to rise, they're likely to benefit.
Oh, that's so great to hear. Like you said, it's so encouraging. And I understand we've seen some exciting policy changes in the past year. Could you tell us a bit about those policies and how they're impacting our work?
Yeah, it's been really a great period. So first of all, one of the things we always say is that if you're not measuring it, you're not likely to do it as often as you would otherwise. And so as a result of the very aggressive work by a small group of people beginning in 2021, began aggressively lobbying Medicaid to measure colorectal cancer screening in the Medicaid programs. And in 2021, in late 2021, their work paid off, and it's been added to the preventive care that Medicaid will be measuring in all states. So we want to give a big shout out to Stoney Anderson and Margaret Hitchcock of the California Colorectal Cancer Coalition, and Bev Green of Kaiser Permanente of Washington for really a heroic effort that is going to result in a change that I think is going to make a huge difference in the Medicaid population. In addition, something that we have been working on, which seems like forever, is to overcome the cost sharing that occurs when someone has a positive non-colonoscopy test. So ironically, we cover screening tests under the Affordable Care Act because we know that any cost barrier to preventive care is a barrier to the uptake of preventive care. So it's really quite paradoxical that at a time when your prior probability of disease has gone up because you've had a positive test, now we're not only sharing in cost sharing, but it's pretty expensive as a result of these tests being involved in diagnostic. So really, after many, many years of sort of describing how illogical this was, the new frequently asked questions from Health and Human Services said, no more. We're going to treat this as a continuum of care. The screening test is not complete if it's positive until you've had a follow-up colonoscopy, and there can be no cost sharing. This also, following the rule I described to you earlier, for plans that start on after May 31st of this year, have to implement this new rule that there can be no cost sharing. So for most plans, it may, if they've already, we don't know. It could either start in May, but it has to start as of January 1st of 2023.
I mean, this is really exciting to hear. And it takes a village because like you guys have everyone has been working tirelessly on this issue. So thank you so much, Bob. Steve, any last thoughts on how we can work together towards 80% in every community this year?
You're on mute, Steve.
Yeah,
Can I
sure.
hear you?
There's no
Okay.
shortage of challenges, with our campaign of 80% in every community. But there have been huge advances in policy, as we've been hearing. And on the same day that President Joe Biden announced the relaunch of the Cancer Moonshot in early February, like Lisa said, the President's Cancer Panel released a cancer screening report, which spotlights innovative approaches to improve the uptake of cancer screening nationally. And it calls for expanding evidence-based programs to better address equity and cancer screening access and outcomes. And the report includes a recommendation to, quote, expand and strengthen national cancer roundtables that include a focus on cancer screening, unquote, and specifically acknowledges the NCCRT as an exemplary model to promote evidence-based cancer screening strategies. So we're very proud of this recognition. We're excited to see the support for roundtables as a catalyst for change. Lastly, we're excited that this is NCCRT's 25th year, and our member and partner engagement is as strong as it's ever been. So the spirit of collaboration around 80% in every community has so much potential for us to learn from each other. And by sharing what we're doing, what's working, but also what's not working, we can build on each other's efforts to make a greater impact by working together.
Oh, that's great, Steve. I mean, and kudos to everyone all around, because like you said, and everyone's been saying, we're making an impact together. We have a ways to go, but we're getting there, and it's making a difference. So thank you, Steve, and our entire panel, Bob and Lisa, you guys are all sticking around for questions. So before we move on to our next panel, one of our favorite things in March is seeing all the energy and excitement for Dress in Blue Day, which took place last Friday. And I know all of us are wearing blue. We want to wear blue all month, but let's take a look at this on Twitter to see some of the great photos that our partners shared from Dress in Blue Day last week. Everyone looking dapper and sharp. I love seeing all these. So a lot of fun there, all of our colleagues coming together. I know kids got involved and pets and the whole thing, and you name it. So it's just really awesome to see the energy for this campaign. all across the country. And we know many of you are hosting events this month. So be sure to share on social media. Make sure you use the hashtag 80 in every community. And reminder, folks, if you have questions for our wonderful guests, please make sure to put them in the Q&A box. So last week, the National Colorectal Cancer Roundtable announced its 2022 slate of 80% Every Community National Achievement Award honorees. The awards program is in its 7th year, and it's really, really competitive. The honorees represent a diverse group of stakeholders and organizational types, including health systems and community health centers and state-based coalitions, elected leaders, and others. So joining us now to announce our grand prize winner is Dr. Keith Winfrey, Chief Medical Officer at New Orleans East Louisiana Community Health Center, a current NCCRT Steering Committee member, and past grand prize awardee for his health center's tremendous work to increase colorectal cancer screening rates. So hi there, Dr. Winfrey. So nice to see you. And will you do the honor of announcing this year's grand prize winner? I know it's a big deal. You know how important this is to recognize folks for all their hard work. So welcome.
Absolutely, Desiree, and thanks for having me. It's a delight and pleasure to be here. Every year, the NCCRT gets dozens of incredible nominations, and it gets so difficult to narrow it down to just a few honorees. This year, we had one such organization really stood out and shined, and that's Pueblo Community Health Center, based in Pueblo, Colorado. Yes, Pueblo Community Health Center has over 23,000 lives under management. In their 3rd year of a center-wide commitment to prioritizing colorectal cancer screening, they've seen a year-over-year increase in their screening rates, despite the challenges that are posed by the pandemic. So we're so excited to honor Pueblo Community Health Center with this grand prize award, and we're just excited to see the work that they've done.
Well, Dr. Winfrey, thank you so much for letting us know this big announcement. So thank you for joining us. And we're thrilled to have 2 people live live with us here today. So thank you to represent Pueblo Community Health Center's exciting work. I mean, congratulations. It is my pleasure to welcome Donald Moore, CEO, and Linda Thurman Sanchez, Clinical Programs Nursing Manager from Pueblo Community Health Center. Welcome. How are you? Congratulations. Felicidades.
We're doing great. Good to see you. And
Nice.
Dr. Winfrey, thank you for the award, and it's an honor to serve with you.
It's awesome. So Donald, we're going to start with you. Can you tell us a little bit about the community you serve and why you decided to place a focus on colorectal cancer screening?
Sure. Thanks, Desiree. Pueblo Community Health Center serves a low-income population of approximately 23,000 patients, like Dr. Winfrey noted, 60% of whom identify as Latino or Hispanic. We're the trusted source of primary care for this population. And one of our really strong core values is quality care. And we always try to achieve a patient-focused culture in everything that we do. We're not perfect, but we strive for it all the time. In 2019, we decided that we could do a better job living up to those ideals with respect to colorectal cancer screening. And we set our minds and work towards improvement. We integrated the goal into our strategic plan, our board of directors and management reporting, our staff development, our QI program, and it was in all of our company-wide communication.
That's incredible. And congratulations again. Thank you, Donald. Linda, could you share with us some of the strategies you implemented to increase screening? I know Donald talked a little bit about it. Can you go in more depth?
Sure, yes, and thank you so much for having us, everybody. So some of the things that we've done is we incorporated a multidisciplinary approach. We wanted to tackle the challenges of increasing colorectal cancer screening rates. And in doing so, we created a clinical program, and we have staff whose primary role is to identify and educate the targeted population. We try real hard to stress the importance of screening, why and how, and alleviate some of the fears that people may have. We also continue to follow them through the workup until screenings are complete. and any necessary follow-up has occurred as well, because in many times, it doesn't stop at the screening colonoscopy, especially if things are identified during that procedure. So we utilize strategies such as motivational interviewing and barrier reduction activities. A lot of our patients need language interpretation assistance. And so we try our best to offer all of that and get patients to engage as much as possible. We also found that closing the loop this way, following them through from beginning to end until diagnosis or a normal result, it allows for continuous motivation and also just improving positive health outcomes in patients. So we closely monitor this. Our compliance rates, we report them every month to a clinical quality improvement committee that we have. And this also allows for looking for ways to continue improving our systems that we've put into place.
It's just phenomenal work. Thank you, Linda. I mean, Donald, talk to us about the results you've seen since you started this back in 2019.
Sure. The results have been tremendous, Desiree, and I just can't be proud of our team, and hats off to Linda. We increased our screening rates from 54% in 2018 to 61% by the end of 2020. I also want to highlight that our screening rate for our patients who identify as Latino or Hispanic was actually higher at 64%. So I think we made headway on reducing racial disparities as well. During the second year of the pandemic, 2021, we reached 62%, so we ticked it up one more percentage point. And remember, this was a year in which healthcare providers suffered significant staff burnout and turnover. It was a very challenging year. I wanted to mention this because I think the best antidote to fatigue and burnout and to stay focused on our patients is to possess and pursue a meaningful purpose. And this what gave us a meaningful purpose among many of which that we pursue. But the people at my organization want to operate at the highest levels of their profession. It's quite inspiring. I think that we fed this desire to be excellent at patient care when we work together to improve these screening rates.
Well, you clearly are excellent. I mean, it's just outstanding, incredible work. So thank you. Dr. Winfrey, I understand your clinic reached 80% screening rates a few years ago, which is so impressive. So how do you keep your team energized and focus on the work year after year?
Yeah, that's right, Desiree. Reaching 80% in 2018 was such a tremendous sense of accomplishment for our organization that we just decided to keep that as one of our core key performance indicators. So every year we kind of set a goal of what we want our clinic to focus on. And because of that achievement, we just said cancer screening is going to be our top performance indicator year over year. And then our staff, they really have taken pride and ownership of the success that we've had and just the ability to pull together as a team, because it takes a team for this screening process to work. And so they just take ownership of it. So much so that even during the pandemic, because we did a stool-based program, we were able to still implement sort of that touch-free option where we could just mail out the kits to the patients, they could complete them and send them back. So our staff has kind of taken ownership of it and continue to focus on that goal.
It really is amazing. And I keep hearing the reoccurring thing, it takes a village, it's teamwork and taking ownership. And it's just awesome when everyone comes together, and congratulations for reaching those rates. Dr. Winfrey, talk to us a lot. I understand that NCCRT is also about to publish an updated step-by-step guide for health centers on increasing colorectal cancer screening rates. Talk to us about that.
That's correct, Desiree. I'm actually serving on the advisory committee to help develop this update. And it's an honor, right? Because for us, that was one of the key tools that we use to revamp our program to help it to reach the success that it is. The original guide was published in 2014, and it was one of the most highly acclaimed tools that NCCRT has in its toolkit. And again, it was one of the things that once we started implementing those steps, we really saw significant improvement in our screening rates. Just as an update, the guide that's going to be coming out here in a couple of months, it's going to include the starting age of 45. We're expanding the scope to reach general primary care and not just community health centers. We've also updated to reflect the latest science and statistics around screening, and it also includes 10 case studies. So you can actually read about 10 different health centers and organizations that really work to improve their screening rates by implementing the steps outlined in the STEPS guide. So we're really excited about it. We encourage everyone to look forward to it. It should be released sometime in late April.
Well, I know we're all excited about it too, and we can't wait to see the guide next month. So thank you for all your hard work on it. This is amazing. So thank you. We want to bring Linda back in. Would you like to share anything more about what's next for your health center's work to continue this incredible work that you're doing?
Well, we're excited because what we are looking to do is incorporate the intense case management of patients that elect or need to have stool-based testing. We want to incorporate that into the clinical program that we developed. And we feel that that's very important, especially in recent times with the pandemic. There's been an increased need for stool-based testing. Many of the GI specialists over the last few months had halted screenings and elective procedures. And so we feel that incorporating stool-based testing will be a big advance and help us to continue to engage patients that way and continue the education and follow up just to ensure that they're doing their part in returning the samples. Because with stool-based testing, a lot of times patients, it's easy for them to forget or not want to go through the trouble of returning the samples. And so if we could follow them, monitor them, encourage them, we feel like that will play a huge role in success as well.
Absolutely. Thank you. We have some questions from the audience, either for Donald and Linda. So what type of messaging was effective in alleviating various fears for patients? For example, suppose a patient is worried about potential downstream effects of a positive test result, such as a cancer treatment.
Linda, go ahead.
Okay, well, so when patients, and it's very common, they do have a lot of fear. Fear of the actual procedure, that they will be uncomfortable, that they will remember. And so we explain, the test itself. And then we also remind them that this is life-saving. And if something is found on the screening colonoscopy, the potential of survival, if it were to be something malignant, something cancerous, the potential for survival is so much more with early detection. And that, I think, a lot of times helps them to process the whole idea of a potential diagnosis, or we tell them you'll have peace of mind because if it's a normal test, then you don't have anything to worry about for a few more years, So we touch on that. We highlight that a lot as well.
Sure, encouraging them and reminding them, like you said, early detection saves lives. Thank you, Linda. Donald, we have a question for you. What advice do you have on getting leadership engaged in championing this kind of work?
Well, I think the point that was made earlier by Bob about measuring and reporting is critical. It brings visibility to it. It brings focus to it. And it just gives a rallying point for everyone to work towards and achieve shared success. So if there was one thing, I would say measure it, report it, talk about it, and use your QI process to improve it.
Good advice. Well, congratulations, Donald and Linda, and all the folks at Pueblo. You deserve this. Keep up the phenomenal work. Congratulations, and thank you for joining us. And also, thank you so much, Dr. Winfrey, for all your insight and for joining us. And we look forward to that guide. So thank you all. We appreciate you being here.
Thank you, Desiree.
Thank you.
Thank you. So now let's take a moment to recognize another one of the 2022 National Achievement Award honorees. As we stated earlier, the NCCRT's National Achievement Awards program tries to recognize outstanding achievements from diverse settings. This year, in addition to our grand prize winner, there were also 5 other honorees. Take a look.
The Nebraska Cancer Coalition was actually founded as a nonprofit in 2010, and to achieve our vision of conquering cancer together. And really that's through our mission of connecting people and resources to strengthen cancer prevention, detection, and quality of life in Nebraska.
Our passion in Nebraska is our people. It is one of our strongest resources. We're one of the best kept secrets, in my opinion, in the country. We have a passion for living, and we have a passion for living life to its fullest. Cancer is a barrier to that, and we want to try to remove that barrier and conquer it as best we can.
In Nebraska, we have this rural-urban divide. We know that there are disparities and discrepancies in cancer diagnosis and treatment based on all these different diverse populations. And we also know that those different communities do best in receiving messages that they understand and they trust, coming from people that are close to them and they trust.
The Fight Back Nebraska campaign is an amazing coming together of multiple forces to really get the word out about colorectal cancer, helping us to share the word with anyone and everyone we can reach about the importance of having a colorectal cancer screening test.
It has been just amazing to see the growth and see how far we have come. We are now really reaching into all 93 counties of our state, expanding our work, getting into those rural areas, and really working with those partners. Really get out there and find out what's going on in your communities, find out what's going on in your state, find out what's going on with your partners, and then sit down and talk to them and listen, find out what works in their community, what they've done before, what are they open to. They know their communities better than we do. They're the experts.
Congratulations to the Nebraska Cancer Coalition. Again, such inspiring work, and to all of our honorees. So again, remember to use the hashtag 80 in every community. If you're posting on social media, let us know what you're doing throughout March and throughout the year. We want to hear from you. Also, make sure to submit your questions. We'll try to get to as many as we can at the end of the show. For all of our guests, they are sticking around for questions at the end. So put those in the Q&A chat box. So up next is my pleasure to welcome our next panel. We are very excited to have Dr. Siobhan Mehta, Associate Chief Innovation Officer at Penn Medicine and Assistant Professor of Medicine at the University of Pennsylvania. Thank you so much, Dr. Mehta, for joining us. And his team are being honored with 80% Every Community National Achievement Award in the Hospitals and Health Systems category. We're also joined by Dr. Joseph Ravenel, Associate Professor in the Departments of Population Health and Medicine at NYU Grossman School of Medicine, and a longtime engaged member of NCCRT. And you guys can see all their amazing titles and LinkedIn bios right there in the chat of all of our guests there. So make sure to check that out. Some great information in our chat box. So Dr. Mehta, congratulations on your award. We're so happy you're here. So tell us a little bit about the community that Penn Medicine serves and how you decide to place a focus on colorectal cancer screening.
Thank you so much for having me. And I'm really pleased to be here to represent a really large team across Penn Medicine. Penn Medicine is an academic health system in Philadelphia with 6 hospitals in the region and over 100 primary care practices. In addition to this patient population, our University of Pennsylvania is situated in West Philadelphia, which is a community where there's known disparities in health outcomes. And that's why our health system leadership in 2020 decided to focus on colorectal cancer screening among Black patients as a system-wide team goal. They knew that there's known disparities in this area, particularly among minority patients, but they also knew that we had a lot of my colleagues and collaborators across our health system that had already done really important work in colon cancer screening. All we needed was system-wide support to galvanize these efforts and really take it to the next level.
I mean, that's fantastic. Can you talk to us a little bit of what kind of strategies did you use to reach this community?
Sure. As with any population health goal, we really need multi-level strategies. And so the first thing was working with a lot of the primary care practices to make sure that they had easy ways to schedule and order colonoscopy as well as FIT testing. But we knew that many patients, particularly during the pandemic, weren't coming in to see their primary care docs. So we had to focus on patients that weren't necessarily coming into our clinic, but we still cared about, and we still needed to figure out how to get them screened. And so in the end of last year, we conducted a pretty large a FIT outreach campaign. We identified 4,000 patients that were not up to date on colorectal cancer screening, mainly focused in the Philadelphia area where we know there's higher minority population and disparities. And we included a bunch of different ingredients that we knew worked from prior campaigns. We did bulk ordering to make it easier for the primary care docs so they didn't have to order every single test. We packaged it in this sort of fancy Penn Medicine branded package so the patients would trust it and trust who it was coming from. We included text message navigation and also importantly, more live navigation for patients that were positive for the FIT testing to make sure that they got the colonoscopy. So as a result of those efforts, we're able to increase our colorectal cancer screening rates among these populations, achieve the team goal at a time when colonoscopy was constrained. In conjunction with that, some of my colleagues also did some efforts in the community among patients who may not get their primary care at Penn Medicine. Dr. Akin Oyalowo worked with the Colorectal Cancer Alliance as well as our local Blue Cross Independents to conduct a radio campaign, sort of a mass media campaign with WURD Radio, which is a Black-owned radio station in the area. Dr. Carmen Guerrero and her team implemented a drive-through screening campaign, actually 6 drive-through screening campaigns in collaboration with Enon Tabernacle Church, which serves 15,000 members in the community.
I mean, that's such inspiring work. And you said it, making sure they trust the process and trust you and, doing the drive-bys and going to the churches and doing the radio campaign in their community. And they see that. That's amazing. Thank you for sharing that. Dr. Ravenel, I understand you've done work to reach Black communities for colorectal cancer screening outside the healthcare setting as well.
Yes, and thank you, Desiree, and congrats to you, Dr. Maida, on such impactful work. We did a research study with over 100 Black-owned barbershops where we tested the idea of putting patient navigators in barbershops to reach Black men who were eligible for screening, but were not screened due to a number of social barriers. And we found that those men who connected to the patient navigator who was in the barbershops, they were twice as likely to get screened for colorectal cancer compared to men who just got a recommendation from their doctor. So our findings and Dr. Mehta's work really highlight the importance of outreach beyond our clinical walls and the power of partnership between the healthcare system and communities of color for achieving and advancing cancer health equity.
Absolutely. That's phenomenal. Congratulations. And like you said, working together with the community. So I understand NCCRT is conducting market research to support partners in promoting the screening in the community health setting.
Yes. So NCCRT has done extensive market research on reaching the unscreened, including deep dives into reaching particular racial and ethnic groups, including Hispanics and Latinos, as well as Asian Americans. Most recently, in 2021, NCCRT conducted market research to identify top tested screening messages to reach unscreened Black and African American adults. NCCRT is now using these findings to create a new colorectal cancer screening messaging guidebook on reaching Black and African Americans, which will serve as a supplement to the 80 in Every Community 2019 messaging guidebook. So through these efforts, we hope to release the guidebook with a webinar in late spring, early summer. So be on the lookout.
Lots to look forward to. Thank you so much, Dr. Ravenel. Dr. Mehta, would you like to share anything more about what's next for Penn Medicine's work?
Yeah, as a result of some of those early successes in the past year, our health system has continued to focus on this as a system-wide team goal. So what we're trying to do is think about how to move it from a sprint where everybody kind of does extra effort on the side to making it the way we do things. We need to continue to do outreach, and we can't just do it once a year. We need to do it throughout the year, and we need to invest in sustainable infrastructure to be able to conduct these types of outreach and navigation campaigns all the time, and not just during, let's say, Colorectal Cancer Awareness Month or any other campaign that we have.
Yeah, all year long, you hit it on the nail. Thank you so much, Dr. Mehta and Dr. Ravenel. Such great information, and congratulations to all your hard work, and keep it up. So thank you. So let's take a moment to hear from another one of our 2022 honorees. Again, our guests will be sticking around for questions at the end. Let's take a look.
The Colorectal Cancer Alliance exists to end colorectal cancer in our lifetime, a mission that we live through our programmatic pillars of screen, care, and cure. Here we're focused predominantly on our screen pillar, which we believe promotes screening, the #1 way to reduce the risk of dying from colorectal cancer. What we wanted to do and where we felt like we had a role to play was in increasing awareness and education of the importance of screening, the safety of screening, and the fact that most people had options even during the pandemic. The Access to Screening initiative aims to help patients understand their screening options and ensure access to screening. We wanted to reach those people who were unscreened, as well as those who were at risk, including populations who experience higher incidence and mortality rates than others. And we had a specific focus within the Black population as well. Through this Access to Screening initiative, the Alliance was able to achieve 12.4 million media impressions of our screening content, delivering over 9,100 personalized screening recommendations to individuals who were either unscreened or at risk. We also supported over 4,000 people on their screening journeys via live navigation and helped to facilitate more than 1,300 screening completions. I think that we at the Colorectal Cancer Alliance have an amazing opportunity to remove barriers and meet people where they are. And being a part of that and being able to create impact in ways that save lives is extremely important to the Alliance. 3 things: know your audience, have good partners that can help you make the work smarter and really inform your strategy. And 3, to have those strong clinical partnerships that really work to remove barriers and increase access to care. It's really important and inspiring to know how many lives we are touching at the Colorectal Cancer Alliance.
Thank you so much to the Colorectal Cancer Alliance. It's incredible work. Everyone is doing so much work. I'm learning so much. So it is my pleasure to welcome our final panel. We are so excited to have with us, again, Bob Smith, Dr. Bob Smith, NCCRT co-chair, and Rhode Island State Representative Mia Ackerman, who is making time to join us before a House session later this afternoon. So very, very busy. Representative Ackerman and her colleague, Senator Mary Ellen Goodwin, are being honored with an 80% Every Community National Achievement Award in the elected leaders category. So Representative Ackerman, congratulations on your award. And thank you so much for joining us. I know you're so busy. Would you share a bit with us about the legislation that you and Senator Goodwin championed and why this issue is so important to you?
Absolutely. So in 2019, Senator Goodwin and I partnered with the American Cancer Society Cancer Action Network, Fight Colorectal Cancer, and other advocates to pass a bill to remove out-of-pocket costs for colonoscopies following a positive non-invasive screening test. So after 3 sessions, 3 years, that's 3 years here, we were able to pass it in 2021 unanimously, and it became official this year in January. So very, very happy about that.
It's such exciting success. Thank you. Bob, would you share with us about NCCRT's work on this policy issue on the national level?
Yeah, well, as I mentioned earlier, that we've been working to get this issue addressed at the national level and finally had success this year, coincident with Representative Ackerman's important work in Rhode Island. But our work is not done. The federal laws do not change Medicare. They do not change non-expansion Medicaid states. So to the degree that more state efforts, they can't influence Medicare, but they possibly could influence Medicaid. We really do need to make sure that these follow-up tests get done and that coverage is not a barrier to them.
Thank you, Bob. Representative Ackerman, I also understand you've worked in a partnership with your colleague, Senator Goodwin, on this legislation, and it became personal for her after it was introduced. Senator Goodwin wasn't able to join us live today, but she shared a very special video message about how she herself has been touched by this terrible disease. Let's hear from Senator Goodwin.
Hello. I'm Mary Ellen Goodwin, a member of the Rhode Island Senate. As part of the Senate's leadership, I helped advance legislation that benefits all Rhode Islanders. I am humbled to receive the National Colorectal Cancer Roundtable's 80% in every community national award, especially alongside my friend, Representative Mia Ackerman. There are so many accomplishments I am proud of. Looking out for the most vulnerable members of our community has always been a top priority. I've advanced legislation to protect children, support domestic violence victims, and help working families. I've also made healthcare a major focus of my work as well. One of the issues most important to me has been removing financial barriers to prevent care for colorectal cancer. Last year, after a 3-year campaign, a bill requiring that insurers cover preventive colorectal cancer screenings and tests in keeping with the American Cancer Society guidelines was signed into Rhode Island law. This is a cause that has become most personal to me, more than I ever could have imagined. In July 2019, just months after Representative Ackerman and I first introduced this legislation, I myself was diagnosed with colon cancer. I have been so fortunate to have the support of so many people over the course of my treatment. I was deeply moved when my colleagues in the legislature dedicated this bill in my name. One of the best parts of my job is getting to meet and work with so many amazing people. They inspire me to keep working every day on behalf of my constituents and all Rhode Islanders. The colorectal cancer screening bill we passed shows that it is possible for compassionate, committed people to make a real difference. I think the lives that will be saved because of the access to this preventive care and how much it will mean to their loved ones. That inspires me to keep working too. When it comes to engaging your lawmakers, remember, they are your neighbors. They live in your communities and encounter the same challenges and share the same experiences. When you speak, they will listen. Reach out and make your voice heard. Be a catalyst for change.
What an incredible story. Thank you so much for sharing it, Senator Goodwin. And you're right, be a catalyst for change. It's always such an inspiration and providing so much hope to so many, to hear how so many survivors are turning their personal battles into advocacy for change. So thank you, Senator Goodwin. Representative Ackerman, what's next for you and Senator Goodwin and your colorectal cancer screening advocacy work?
Yeah, well, it continues. Today, actually, on the House floor, I have this, a resolution to proclaim that March is Colorectal Cancer Awareness Month. And it'll give me a chance to get up on the floor and speak about it and encourage my colleagues who are over 45 and above to go and get screened themselves and to spread the word to all their family members. And I do this every year. So we'll continue to do that and whatever else needs to get done.
Well, we thank you so much, Representative Ackerman, for all your hard work, and to Senator Goodwin and spreading the word that early detection saves lives and breaking down all these barriers for colorectal cancer screening. So thank you.
Thank you so much.
Thank you, Bob. So what's next for NCCRT in addressing this issue?
Well, these are inspiring stories at the local level, and we've turned the corner to go from 80 by 18 nationally to 80% in every community. So literally, we want to make sure not only that everybody gets screened, but that anybody who needs follow-up gets it as well. One of the things, even if you've got coverage, we know that there are barriers to follow-up. Sometimes the communication about the importance of follow-ups is not there. Transportation is a barrier. Getting off of work is a barrier. If you are Medicaid insured or Medicare insured, you may not find that there are practices that will take you as a patient, or they may be quite a distance to go. It is a leading cause of death and for people who are not followed up on time or not followed up at all. So what we need to do is to really have the metrics that say if you have a positive test, your screening has not been completed until you have that follow-up. More to the point, we need systems that make sure that people do not get lost. You know, some inertia sets in, the next thing you know, too much time has elapsed. We basically need to have a shared sense of responsibility, a division of labor, to make sure that if you have a positive test, your follow-up is timely and assured.
Oh, so many important points. Thank you so much, Baba. Dr. Bob Smith, our Senior Vice President of Cancer Screening and also NCCRT Co-Chair. And thank you so much, Representative Ackerman, for joining us. We so appreciate all your insight and all the amazing work you're doing. So thank you. So now let's take a moment to hear from our last honoree. And again, our guests will stick around for questions at the end. So make sure to stick them in the Q&A box there.
Hitting Cancer Below the Belt is a colon health, colorectal cancer prevention nonprofit. And our primary service is we actually fund access to timely screening for colorectal cancer across the state of Virginia. We also offer support services for cancer patients, and we have a large educational initiative using various modes of teaching. And some are highly entertaining, such as our inflatable colon that is very popular to provide this type of education in an effort to prevent and defeat colorectal cancer.
We've had numerous other programs throughout the years, including Free Colonoscopy Day. And as an extension of that service, in order to reach more people, to help more people, we started this free clinic fit screening program to provide an affordable, relatively easy to use in-home colorectal cancer screening tool. And we've seen since then over 2,550 people screened through the program.
And where does our inspiration come from? And I would have to say it's got to be from our survivors. We do offer cancer patient services, but the survivors who have come through such a horrific journey are the ones that inspire us to do our work every day. And it's important for us to make sure that our partners understand that we're not just looking for funding, we're actually looking to serve their members, their employees, their colleagues as well. So it's a very mutually beneficial relationship when we actually do partner with folks across the state of Virginia.
We are getting so much love in the chat for all of our panelists. And, we want to congratulate them all again. Our award winners, just such amazing, innovative work. And it's another reminder why we do what we do and why we are here. And those survivors, all the survivor stories, it's incredible. So thank you so much. So we do have, we are waiting to, I'm looking through the questions really quick to make sure we get them all. But I know our first one is for Lisa. And so give me 1 minute. I'm looking it up. Dr. Richardson, how are you? What a great program, isn't it?
Absolutely fabulous. Yes.
All right. So let me make sure I am looking here. This is the beauty of, managing the chat and all that. So, okay. So does the Moonshot effort include consideration of financial support for navigators? And this can be very helpful in increasing screening efforts. That's the first one. And we'd love to hear from you about CDC's ability to cover follow-up colonoscopy. How's it going? And what is the CDC learning?
So the first question about the Moonshot is the how that's going to be implemented is still in the works. So the main part of it is for treatment, treatment and research, which is what the vice president is interested in. The second part is screening. And so I think, for us to what's the word for, advocate for navigation, because that is part of the process of helping people get what they need. And we've heard a couple of very successful stories here today about how navigation can help care or help people get the care they need. Secondarily, within a colorectal cancer control program, we have allowed our programs to set aside a certain percentage of money, depending on what they need to provide colonoscopies after a positive fit, if they choose to do that. So, but the bigger issue is who's going to cover that. And with the money that we get, it's impossible for us to cover all that's needed. So it really is about, we've heard, stories again here of people donating services, but it is a bigger need and fix for that problem for people that don't have insurance.
Okay, thank you. Dr. Lisa Richardson from the CDC. I'm sure we'll get some more, but so stick around. Thank you, Lisa. Dr. Winfrey, this is for you. Do the 80% and above clinics offer Cologuard screenings, or are these numbers only of the colonoscopies?
Yeah, so for us, we reached it using the FIT test, actually. This year, we are venturing to using Cologuard, and we're excited about that because we feel like once we get more of our patients satisfied with this measure, the lift from year to year won't be as great. But when we reached in 2018, that was using primarily the FIT. And for those who were willing and able to get the colonoscopy as well. That was only a small percentage for us.
Okay, thank you. Steve, this is for you. Any thoughts on blood-based colorectal cancer screening, future benefits?
Yes, there's certainly promise in blood-based screening. You know, it's obviously very convenient. It a lot of the barriers that we see with colonoscopy and even stool-based testing may go away to some extent. It's a little early to know exactly how blood-based tests will get positioned. We need to see the performance metrics, the sensitivity, specificity, but it's certainly on the horizon and a welcome addition, I would say, to getting more people screened if they'll choose that.
Yeah, thank you. Listen, I learned so much from our webcast each year. And you know, again, I thank you to our audience for just putting in such great comments in the chat. Everyone's showing so much love for our award winners, our panelists, or you know, we have such amazing speakers and we just learned so much. We're already looking forward to next March, and we've got a lot to do. So Steve, what do our viewers have to look forward to before then? We got a lot going on this month and all year.
Yeah, thanks, Desiree. So first of all, the NCCRT is proud to sponsor an upcoming colorectal cancer, the Association of Black Gastroenterologists and Hepatologists. So please join the ABGH on Thursday, March 10th from 8 to 9 p.m. Eastern Time for the Let's Beat Colorectal Cancer, an update for the Black community. And let's learn more about how we can help all of our colleagues, but particularly the African-American community. You can learn more about that. There's a link in the chat for those who are interested. Second, later in this month, NCCRT is launching a new webinar series that we're going to call the Blue Star Conversation series. This is a new series that will feature brief presentations followed by small group member discussions. And the first one will take place Tuesday, March 29th from 12 to 1 Eastern. And if you're already a member, follow the link to register in our member newsletter that went out earlier today. And if you're not a member, learn about membership and consider applying through the link in the chat. Third, we hope you're already planning to join us for the 2022 80% in Every Community Conference and NCCRT's annual meeting this fall. We'll share the date and more information in our newsletter very soon. And last but not least, we're excited to be releasing a suite of updated materials for you this month. Keep an eye out for the materials in our newsletter and our website in the next couple of weeks. Be sure to check out nccrt.org and our social media channels often. We always learn so much from you. So please be sure to share what you're doing this March and the rest of the year with hashtag 80 in Every Community. Thank you.
Oh, that's awesome, Steve. So much going on. And you said it, just amazing conversations. And I know we all learned so much. So such great work. Congratulations to everyone on your incredible, impactful work. Keep it up. Thank you, Steve. And thank you to all of our guests. We so appreciate all that you're doing. And thank you for joining us. And we're excited. And we're going to see you next year. Keep up the great work. Thank you all for watching and helping us reach 80% in every community. Have a great day. Thank you, everyone. Adios. Bye-bye.